So in this section, we'll be discussing the personal identity from the skull. We have our hands on the skull and it is unidentified at that time. Even we can have a lot of other bones at that time as well, but the skull is the mainstay for the identification of the person. We have to basically facially reconstruct for the identification of the person. It's very important. And the facial characteristics are the mainstay for the personal identification of any person. It can be of archaeological importance as well as the criminal investigations which involve the personal identification of any person forensically. It's also very important to identify a person from the skull, what ancestry he belongs to, and the other characteristics as well. So the individual characteristics, they're also discussed in this section, the frontal sinus and the postcranial identification. It is very important. Then moving on, we'll be discussing the photo superimposition techniques. As I've already told you, there are a lot of softwares that have been devised in this method. A lot of indices are already put in that software. We don't need any sculpturing ability of the operator, as was devised in the older methods, for example, the Gerasimov method. So this is basically how we facially reconstruct a skull that we have found, and we have to get back to its identity. So it's very important. The frontal sinuses and the postcranial identifications are very important. The indices are put in different formulas that have been devised, and the identification of the person is devised in these methods. So basically, the personal identity is mainly based on the skeletal remains that have been found at any site. The bones are examined for any idiosyncratic features. So whenever we have any bones or any fragments at our hand, we have to identify whether they are from the human remains or they can be any artifacts that are present at the crime scene. So first of all, we have different methods, we have different lab and chemical tests that can be performed to differentiate the fake bones, the fake fragmentary materials of the bones that resemble the bones, but they're not bones actually, from the real bones. And we even have to differentiate the bones, the animal bones, from the human bones. And that also have a lot of chemical and physical tests that can be performed for that. Now, dealing with the individual characteristics, the anatomical shapes are matched by radiology, measurement, or other means. So whenever we have, for example, we have a femur at our hand, we have to perform radiology on that particular bone, and the measurements, the indices are very important if we have to put them into different formulas and other means. So the examples are the frontal sinus comparisons, the craniometry, the radiological bone architecture. So whenever we have the x-rays at our hand, we have to compare the Haversian canals and the osteoblasts, the osteoclastic activity that is found on the radiological examination. And even the sandwich appearances, they also basically indicate towards the archaeological era these bones belong to, and that also helps in the identification of the person. So the discrete abnormalities, they have to be found and they have to be noted down. And these involve basically the healing fractures, the metal prosthesis, if they are found on any radiological examination or any naked eye examination, they can also be noted down. Then moving on, the bone diseases and the congenital defects, for example, there can be any Thales pedis, for example, and it is very identified very easily on the naked eye examination. It doesn't need any radiological examinations that can also be diagnosed at this level, and they have to be noted down. Some artifacts, for example, the drill holes or the wires immediately indicate the bone is an anatomical specimen. So, as I've already told you, it is very important to identify whether it's a real bone or whether it's a human, whether it's an artifact bone. For teaching purposes, for example, it has got a lot of basically wires and holes along with it to hold down and to make the joint appearances. So this is how basically you identify whether the skeletal material is really from the humans or it is an artifact material. Now, the frontal sinuses and the postcranial identification is also the mainstay, basically, which involves the forehead-nose position, which was recommended by Schuller, with the tube axis positioned level with the supraorbital margins. So this is basically the whole method which was devised by the Schuller for the frontal nasal and the postcranial identification. It is a very useful method in mutilated and the burnt bodies. And for the sinuses to be used, an antemortem anterior-posterior skull radiograph must be available for the comparative studies as well. So if we don't have any comparative radiographs available at our hand, it is sometimes quite difficult to devise this method. The cadaver skull or the head must be x-rayed in a way to employ the superimposition techniques. The superimposition technique is the mainstay whenever we are basically postcranially identifying a skull. So we have to basically get back to the previous knowledge, and even we want to have the comparative radiographs at our hand, and only then we can devise the superimposition techniques at this level. The scalloped under margins of the sinuses are used for comparison. They can be smaller and more numerous in the females, and the details of the sphenoid sinuses again are also very important. The mastoid and the ethmoid ear cells here are also of great significance. The torcular and the sagittal cranial sutures. All of basically these mainstays of the skull are very important whenever we are identifying or whenever we are getting back towards the ancestral remains, or whenever we are going to identify a person on the basis of the skull for the superimposition techniques. The other techniques are also devised for the identification from the skull. Along with radiography, we have the CT scans, we have the statistical studies of the number, position, and the length. Now, the frontal sinuses are also important, and they can be viewed through the X-ray examinations. The postcranial identification, again, is very important at this level. It involves basically the thoracic X-rays, the vertebral, the costal, and the clavicular morphology is very important at this point, and the bone trabecular patterns are also very important for this identification method. The photo superimposition techniques which are devised for the identification basically involves the photographs of the skull taken in some orientation in 3 planes as available photographs for the comparative studies, as I've already told you. Then they are enlarged to exactly the same dimensions. The negative or the positive print is made on the transparent film for the comparative studies. And they're laid over the photograph, and then they're adjusted. The matchup, the major anatomical landmarks such as the nasion, the supraorbital ridges, the mandible, the nasal aperture, the external auditory meatus, and the teeth. So all of these anatomical landmarks that were marked during the process of identification, they are basically highlighted in the superimposition techniques, and how we get back to this facial appearance, it's basically highlighted. As you can see in this, this was the skull that was found, and this was this photo superimposition technique that was devised for the facial reconstruction. We can use the 3D laser scanners for this method, and the actual anatomical markers will depend on what is visible in the frontal, in the lateral, and the oblique radiological views that were carried out during this technique. So in this section, basically, we dealt with whenever we have a skull at our hand and whenever we want to get back to the facial appearance that was actually when the person was living, how can we get back to that? The modern methods, for example, the photo superimposition technique is discussed in this section. Thank you for watching sqadia.com.